Welcome to TCARE. Let's introduce you to the product, explain why the system was created, and highlight the benefits of TCARE for caregivers and organizations. TCARE stands for Tailored Caregiver Assessment and Referral. It's a software-supported protocol that is used by social workers, nurses, and other professionals to support family members who care for ill or disabled family members. TCARE enables family members to keep their loved ones at home longer. The TCARE system is licensed to customers and it's used by their professionals who are trained and certified as TCARE specialists. The TCARE specialists interview family caregivers using the TCARE assessment. When the TCARE system uses its scientifically validated algorithms to identify the specific drivers of the caregiver's distress, which enables TCARE specialists to create an individualized care plan that reduces caregiver stress, prevents burnout, and allows their loved ones to age in place longer. The software identifies the optimal types of services and resources to address the caregiver's needs. It also identifies providers in the caregiver's community that offer the recommended services. The TCARE specialist then creates a preliminary care plan, consults with the caregiver to share that plan, and explain the benefits of the plan for the caregiver. Based on this discussion, the care plan is finalized with the services the caregiver has agreed to engage with. Because caregiving is a journey of change, it's crucial for the TCARE specialist to check in with the caregiver for follow-ups at regular intervals. Follow-up assessments are recommended every 3 months. Between these follow-ups, the software, through automated processes, will perform regular check-ins on the caregiver to see if their situation is changed, are in a crisis mode, or need changes to their care plan. So why focus on family caregivers? Why should an organization take on yet another client group when resources are already stretched? Because caregivers are the key partners in health, long-term care, and assisting a loved one with aging in place. Family caregivers provide 80% of the care for ill or disabled persons. They not only provide most of the care, but they also monitor the care that is provided by other professionals. They're the hub for communication with health and social systems. They are advocates for the patient. They make critical decisions about care, and they are responsible for keeping hope alive for their loved ones. The economic value of the care provided by informal caregivers has been estimated to be $470 billion, which is greater than the total amount spent in the U.S. on Medicaid services for older adults. Studies have also shown that the presence of a family caregiver results in shorter hospital stays, fewer readmissions, prevents unnecessary physician visits, results in fewer emergency room visits, and delays or prevents nursing home placement. Ultimately, the care benefits that family caregivers provide patients and organizations often come with a high cost to the family caregiver. Family caregivers frequently feel very lost, alone, and in need of support. Often, their own personal health declines. In the year 2000, the federal government first acknowledged family caregivers through the introduction of the National Family Caregiver Support Program, which was an addition to the Older Americans Act known as Title IIIE. The program provides 5 types of caregiver support. We've learned that, while valuable, this program as implemented can fall short of meeting the needs of caregivers in the community. Research shows there is no single caregiver role. Caregivers are very diverse, and their needs often change over time. To be effective, support programs for caregivers must include a much wider array of services and resources that target their specific needs. We've also learned that supporting caregivers can be a challenge. Organizations and practitioners have consistently encountered barriers to the effective delivery of support services to family caregivers. Because caregivers typically don't self-identify, they see the care they provide as a normal responsibility that is associated with their familial or friendship roles. Consequently, it's often hard to reach caregivers, and resources are wasted advertising services to caregivers who don't understand they are caregivers. Often, by the time caregivers recognize their role as a caregiver, it's very late in the caregiving journey. For many, it's too late for them to benefit from the services that are available in the community. Caregivers can also be very resistant to using services because they don't see the value in the services or how it could benefit them in their role. They don't believe they need the services. An example is support groups. Caregivers often have preconceived notions about services and quickly decide it's not for me. When caregivers do not understand how the service will benefit them, or they see it as too costly in time, money, or emotion, they will not use it. Additionally, evidence from research has not supported the value of many support programs in terms of a positive outcome for the caregivers. This is due to the inability to successfully match support services to the specific caregivers for their care context needs. As a consequence, policymakers can be reluctant to allocate resources to family caregiver support programs. Historically, programs tend to use measures of functional levels, known as activities of daily living, or ADLs, or instrumental activities of daily living, IADLs, as the primary criteria for eligibility in caregiver support programs. TCARE is based on 30 years of extensive, peer-reviewed research of family caregivers. The research shows there is no relationship between the ADL, IADLs, and the likelihood of a caregiver to place a family member in an alternative care setting. If you only focus on the functional ability of the care recipient, you're not using the correct mechanisms to effectively target support services. TCARE's research has shown that it's not the condition of the care receiver that best predicts out-of-home placement, it's the well-being of the caregiver. There are numerous measures of well-being that TCARE has identified that are highly related to the decision to place the care receiver in a nursing home. The relationship between placement and each of these measures is statistically significant and is included in the TCARE assessment. The research leads to the conclusion that our caregiver support programs will be more effective if we focus on the caregiver's needs and not on the care receiver's needs. It's with this understanding that TCARE was created. Based on extensive research, the TCARE protocol is guided by the caregiver identity change theory, which will be discussed in more detail later. The TCARE system was initially created in collaboration with thousands of caregivers, hundreds of care managers, and more than 40 provider care organizations, including area agencies on aging, AAA, state units on aging, home health agencies, the Alzheimer's Association, and Soldier and Family Assistance Centers within the U.S. Army. TCARE has been tested through numerous randomized trials and is proven to lower caregiver stress and depression. It's also been shown to delay out-of-home placement and reduce costs. There are many benefits for family caregivers who participate in TCARE. The process leads to greater adherence to care plans, meaning higher engagement rates with these services. This compliance translates to better mental and physical health for the caregiver, better care for the care recipient, and increased ability and willingness of caregivers to continue providing care. TCARE prevents caregiver burnout. The TCARE system has also been shown to benefit TCARE specialists. It enables them to gain information about the family and the care context in a very efficient way using a uniform approach. It's easy to use, identifies the root cause of the caregiver's stress, and all of the information that is gained is used to develop an optimized care plan for the individual caregiver. TCARE specialists have consistently reported that the system saves them time, improves outcomes, and provides visual evidence of these positive outcomes. The remaining lessons included in the TCARE training program will introduce the caregiver identity change theory and other key concepts that are the foundational elements of TCARE. The lessons will help you understand how that theory has informed the development of the TCARE assessment tool and the process for selecting services to meet the caregiver's needs and the process for creating care plans. The training program will also include activities that allow you to use the TCARE system to practice the TCARE protocol.